Show of hands if folks have attended a tabletop exercise, right?
I'm Satchit Balsari. I'm an emergency physician and public health practitioner at Harvard. Harvard has been hosting these interdisciplinary, multi-sectoral simulations for city officials from around the US for several months now. We've done several iterations of this. The goal is to underscore that climate-related extreme weather emergencies cannot be thought of as a typical disaster where you have, starting point and an ending point and the response is just acute. This is recurrent, it's severe, but it's also protracted. And the way we are thinking about this in emergency management, in city response and urban response, just needs to be very different from how we've been thinking about disasters in the past. Extreme heat impacts cities in myriad ways. We think about extreme heat mostly in the idiom of heat waves. That's what we see in the news. There are a few very hot days and the city feels its impact. Often we measure it in terms of mortality. A whole lot of people died because it was very hot in place X, as many as 15,000 in Paris after the Paris heat waves. Back to Chicago in 1995 when hundreds died. But in our group, we're really concerned that we're missing the vast majority of the impact if we limit our imagination just to heat waves. We should really be thinking about the sustained heat exposure for days, weeks, and months as summers get hotter, as summer days and summer nights get hotter. And therefore, the impact then on the cities is mediated through its impact on health, on food security, on transportation, on energy demand, on the grid, and so on. Because the simulation is structured to be interdisciplinary, there are lawyers, scientists, medicos, public health folks, both teaching and participating in this along with the city officials. We would like city officials to question assumptions about heat exposure, heat adaptation, heat impact ascertainment that we all perhaps collectively share right now. Are our exposure metrics correct? Are the thresholds that we have set appropriate for the wealthy and the poor? Should they be job dependent? Should they be neighborhood dependent? The experience can be so varied depending on how you work, where you work, and what you work in a city. You could be a construction worker, you could be a waste recycler, you could be working in an air-conditioned office. And it's really important to sort of factor these layers of vulnerability in, and that's just the nature of work. Age poses special challenges to our very young, to very elderly. You want to think about comorbidities, people with cardiovascular disease, kidney disease, and all of that entire sort of universe of possibilities and intersecting vulnerabilities all exist within a city.
The misconception is that, it's hot here, I've dealt with it before, it should be fine. But in actuality, it's not the same heat. These heat waves have become more intense and longer, and the overnight temperatures relating to the urban heat island offer no relief. So when it's in 90 degrees, the low is 90 degrees, you're just not getting any relief whatsoever. So people need to take this very seriously.
We've had cities from across the US, from New York to California, cities like Phoenix and Tucson who are grappling with heat year after year, and cities like Boston and New York who are beginning to recognize that heat will be a major driver of crises in the summers in these cities as well. City officials are able to operate within the guardrails of their job descriptions, whether there are pre-existing standard operating procedures for heat, whether there are heat action plans. In our experience, regardless of sort of what the formal position is, these city officers live within their communities and they can see that those most impacted are already acting. They don't have a choice. The cost, the burden of heat adaptation is borne by the poorest. They have to try and get themselves out of harm's way. And what we're learning is that most city heat officers are doing what they can to leverage the power of the state, the private sector when they can, to mitigate the impact of extreme heat on the lives of their citizens. This manifests itself in myriad ways, from commissioning more misting stations to cooling centers to negotiating change in working hours for their outdoor workers, to alerting health systems and hospitals to be prepared for patients coming in with heat exhaustion and heat stroke, and on and on. And there is sort of a range of these both acute and long-term adaptations that we find city officers around the world advocating for. We've been running disaster drills around the world for a very long time at Harvard. What is different about this is that we have relied on hundreds of hours of archival news footage, but also inserted these little info sessions that allow us to highlight the latest science and policy advances that our faculty are directly engaged in, but to do it in a room full of practitioners so that they inform each other. I think this model has worked really successfully over the past year. We've done this several times now, and we're hoping to expand this portfolio to wildfires, floods, hurricanes, first in the United States, and then elsewhere in the world as well.